7:40 right now. Welcome back to CW Iowa Live. And of course, with the weather changes we've had here, the roller coaster ride that we've had, Jackie, there's a lot of people getting sick out there.
Yes, there is. And they're saying this could be possibly one of our worst flu seasons, or at least matching some other bad ones that we've had before. So we're very excited, of course, to have Sherry Schmidt joining us in studio from Medicap Pharmacy. Let's first talk about the flu. It's still going strong.
It is.
Is it too late to get the flu vaccine? I always feel, because you say it about takes 2 weeks for it really to take over. So I'm like, well, it's too late now, right?
It's not too late. So the flu is circulating right now, and as you said, they are saying it may be one of the more worst seasons. It's the H3N2 virus that's predominantly circulating this year, which tends to hit children, elderly, people with chronic diseases and compromised immune systems. It does take a couple weeks to build up and become effective, completely effective, but it's not like it's zero and then everything at 2 weeks. So you get a little bit more immunity every day.
Okay.
So go get a flu shot. It's still the best way to protect yourself.
No, you always hear, oh, it's cold in flu season, or it's definitely flu season. How long is flu season?
Flu season, really, honestly, flu can circulate throughout the entire year. It's not very common throughout the year,
So
but
why
it's
do they
a
call
virus.
this? Yeah, why do they call this flu season?
Because this is kind of where the peak is at this time of year. So typically in Iowa, flu season will peak actually 40 or 50% of the time it's in January or February. So it can happen as early as October or November, as late as March or April. So it's really kind of a large time frame. It really just kind of depends on when that virus sort of takes off and starts circulating.
All right.
Why are they saying this is one of the worst? Like, you're hearing news stories coming out saying it's not helping all strains or strands of the flu right now. Is it really important to get that flu vaccination?
It is. The flu shot is still the best way to protect yourself from getting the flu. The flu virus can kind of mutate and be a little bit different than what's in the strain. There can be different strains circulating. I believe it's predominantly the H3N2 circulating this year, which is in the flu vaccine. It's just that everyone's immune system isn't as good at making antibodies so you still can get sick. But most physicians will tell you that if you get a flu shot and you do get the flu, it's usually a milder case that's less likely to have you hospitalized or with serious complications.
Okay, and we want to highlight the great work Medicap Pharmacy has been doing, not only many locations, so you can stop in any time to get that flu vaccination if you haven't already, but you guys were teaming up and giving back in a big way if people were getting that flu vaccination.
We did. Between October 1st and November 15th, I believe it was, we donated meals to the food pantry for every flu shot that was given, and we donated over 60,000 meals across our 9 counties of the areas that we serve. So we want to say thank you to everyone who came in and helped us out with that promotion by getting a flu shot.
That is huge.
It's very huge, yeah.
Great job out of you.
Yeah.
All right, but this morning we also want to make sure we talk about how Medicap Pharmacy can help people, especially at the beginning of the year, and with some of these changes you may have experienced with insurance.
Exactly. Probably one of the most common things we hear is, why is my prescription so expensive in January? They'll say, last year I paid $0 or $10 or $25. Why is it $50 or $100 this year? And there can be a lot of different reasons for that. So it could be that your copay has changed. So maybe you had, copays generally go on tiers. So there's tier 1, 2, 3, up to even 5. Tier 1 is typically the cheapest, the lowest cost generics, things like that. And so maybe it's that your tiers changed. So maybe your $10 copay became a $25 copay at the beginning of the year. It also could be that you have a deductible. People forget about those.
Right.
And a deductible is where you have to pay the full cost before the insurance starts kicking in and picking up some of the cost to where your copay comes into effect. And a lot of times we see a combination of where you're paying a deductible and then a copay on top of it. So things can be really expensive at the beginning of the year.
But that will eventually go down in some plans.
It does, yeah. In most plans, it will eventually go down. Once you've met your deductible, then usually the cost will go down.
Is there a situation where our local pharmacist can help save us some money, though, no matter what kind of insurance we have?
Absolutely. So if you talk to us about something being expensive, we can definitely help out with that. We can either find something that's a lower tier copay, because that's the other thing. You have formulary lists, what they call preferred medications, and sometimes those change throughout the year. So maybe an inhaler or an insulin that you were on last year was a tier 2 or 3, and maybe this year it's a tier 4 or 5. where it's much more expensive.
Okay.
But there's something very similar to it that we can suggest to your physician. And honestly, like, some physicians have preferences, but for the most part, physicians just want you to take your medications because, as C. Everett Koop said, the medications that don't work in patients are the ones that they don't take. So if you have something that you can't afford and you're not going to take it, then a physician would much rather usually have you take something that you will take and can afford to take.
And let's talk a little bit about brand names and generics and the misconceptions some people might have about the brand names versus generics.
The misconception, some people think, well, it's a generic and it doesn't cost very much, so it can't be as good. Not true. It just means that the patent has expired on it, and so other companies can make that same medication. So with competition, you get lower pricing. So they go through the same rigorous testing. They have to be what's called AB rated, which is a rating that's given by the FDA to show that the medication is dissolved, absorbed, metabolized, the same as the brand name drug.
Right.
The only thing that can sometimes be different if you have some allergies to things like maybe lactose or gluten or some of the fillers that go inside, or dyes maybe, you know, like a red dye allergy, those things can sometimes be different. So you would want to talk to your pharmacist about that. But typically the medications will work exactly the same.
So it sounds like the big takeaway is just don't be afraid to ask. Talk to your local pharmacist, create a relationship there, and find out if possibly they could save you some money so that you understand the medication you're taking, but why it's important, and then also find out if the generic might be better for you as well, because you could save some money there as well.
Exactly, because we're not there to judge you, and there's a lot of reasons that people don't take medications. It may be cost, it may be that they're having a side effect, it may be that they don't even know why they're supposed to take it. I think 40 or 50% of new prescriptions written by physicians are never filled, ever. So
that many?
That many. So just talking to your pharmacist about, why did my doctor prescribe this? Why do I need it? Why is it making me feel this way? Is there something I can do to help with the side effects? We're there to do more than just put the pills in the bottle. That's really when our job starts, is once we hand you the medication, then all the education, monitoring, follow-up that comes after that, that's all, everything that we do after we dispense the medication.
Okay, now Sherry, we're talking about the beginning of the year now. Maybe some people are at employers that may have changed insurance companies at the beginning of the year, and now it's starting to roll around the first time they might need to refill their prescription. How do they know whether or not you guys are able to fill their prescription and take advantage of their plan?
That's a good question, and you can call us. We accept most insurance plans. We're preferred on several of them, including SilverScript. So you can either call the 1-800 number on the back of your card or go to the website there. But honestly, the best way is just to call the pharmacy, because sometimes even like your card may say another pharmacy on it. So people are under the impression that they have to go to that pharmacy because another pharmacy is listed on their card, but that's usually not true. We accept most insurances. Just give us a call and we can let you know if we take that insurance.
And you have plenty of medicap pharmacies
in the
neighborhood, don't you?
We do. We added a few locations this year, and we have a new website, new year, new website. So our new website is www.mymedicapharmacy.com. I think we're up to 19 different retail locations.
Wow.
So yeah, so hopefully we have one near you. You can come in. Because the big thing we want to let people know is they should expect more out of their pharmacy, more than just putting pills in there. It's a relationship, and the pharmacist is a big part of your healthcare team, and we're there to help sure that you have good health and meet your healthcare goals.
That works, and you can save them a little bit of money too.
Save them some money. We usually can.
Love it. Perfect. Thank you, Sherry, very much.
Yeah,
very hot topic this time of year, and hopefully you're able to start that conversation so you can save some money into the new year as well. There's a look at all those great locations, and as you said, brand new website. Check it out, mymedicapharmacy.com. You're watching CW Iowa Live right here on Channel 23, where we'll continue to talk about great things happening here in Central Iowa. We'll be right back.